The new COVID-19 Delta variant, responsible for India's outbreak, is growing across the U.S. and Texas. Last week, it made up 2% of cases in the Texas region. Now it's up to 10%.
I don't think it's a concern. I think it's probably a certainty that's going to come here.
John Sims is the director of UNTHSC's Safer Care Texas, helping with vaccine outreach. While the Delta variant is more contagious and causes more serious illness, vaccines are still effective against it.
And I really hope that we have learned from this pandemic that we really need to be more proactive this time.
But Texas vaccinations have slowed, and just 46% of eligible Texans are fully vaccinated. The CDC director recently called the variant an opportunist.
Communities that are not well vaccinated, that haven't hit vaccination targets that we're looking for, are those that are going to be most at risk of the future.
The weekly average of COVID hospitalizations in Texas has gone up 4 days in a row, which hasn't happened since mid-April.
And we have the tools to prevent it. We should exercise those tools.
Dallas County says they're figuring out how to legally create a lottery or cash incentive program for vaccines, and the Dallas Regional Chamber is launching vaccine giveaways from American and Southwest Airlines and local pro sports teams. Sims says more vaccine access and education are the key to getting rates up and preventing unnecessary suffering.
The risk from COVID-19 far outweighs the risks of getting the vaccine.
In Fort Worth, I'm William Joy.